Addressing social determinants of health.
HIV does not occur in a vacuum. There are several other factors that influence whether or not someone is able to get the care that they need.
In this ever-changing environment of HIV prevention and care, CBOs do have a heightened awareness of how health inequities need to be addressed and that they can't be addressed in a one-size-fits-all approach.
We do a lot of work with faith-based organizations and getting them engaged in the process of breaking down stigma within their communities, looking at how to break down some structural barriers that sometimes religion might cause in HIV/AIDS work. We do a lot of work looking at overcoming communication barriers and integrating health literacy to make sure that when agencies are providing services to clients, that they're doing so in a way that their populations understand.
I want to talk about the work, really great work that's happening across our entire department, 8,000 people at the San Francisco Department of Public Health. We're doing work on racial humility, and I want to thank Barbara Garcia, our Director of Health, who's really prioritized the importance of doing this internal work to look at our unconscious biases and how we as a department may in fact be contributing to the disparities in HIV as well as in other key areas. So great thing is we're working with Dr. Ken Hardy from Drexel University, who's facilitating a number of groups with executive leadership and developing a training of trainer model for our entire department. We're very fortunate to be able to work with him and can help share this resource with other health departments that want to do this important work.
CBOs are really thoughtfully incorporating the social determinants of health into their program and planning work to ensure that they are effectively reaching and affecting the lives of the most marginalized and vulnerable in their communities.
JSI works really closely with community-based organizations across the nation in order to help their clients that are living with HIV to enter care and ultimately obtain medication adherence. With this, we're really hoping that these communities can achieve viral suppression and ultimately live longer and healthier lives.
So our capacity building work must focus on addressing multiple social determinants through a lens of intersectionality, which means increasing organizational and community capacity through leadership development, workforce development, coalition building, and social capital, especially strategic partnerships and program development, which focuses on access, engagement, retention, and daily improvements for people living with HIV and those most impacted.
Our CBA services focus on developing individual and organizational cultural competence. We do this through assessment, training, and policy development. We impress upon our client organizations that by providing culturally and linguistically appropriate services, their clients will become more engaged in their healthcare and will be more likely to link to HIV medical care if living with HIV.
One of the ways that we specifically address homophobia here at the Health Forum is through our cultural competency assessments as well as in-person trainings with health departments and community-based organizations.
At the California Prevention Training Center, we've been working on social determinants of health for a long time. We have a specific training that addresses the social determinants, and this year we actually have revised it to work specifically with HIV planning councils. We had the opportunity through a CRIS request to work with the state of Missouri, helping their HIV planning council to address the social determinants of health in their plan and helping them integrate social determinants in their planning council, but also to help them talk about it when they go back to their individual communities and include it in the work that they do.
In particular, when we are going on Hill visits and meeting with congressional members, we're making sure that we're highlighting the disproportionate share that young Black MSM are facing within the HIV epidemic, as well as what is causing their epidemic rates to be so high. Additionally, when we're wanting to make sure that we highlight the disparities that are happening with Asian Pacific Americans and injection drug users as it relates to the hepatitis C epidemic here in the U.S.
We try to address barriers that affect marginalized and disenfranchised communities, and we always try to incorporate discussions around stigma, homophobia, transphobia, and heterosexism in our work.
We've been able to address the needs of rural communities, especially in response to the Indiana outbreak. Through this work, people are beginning to be more mindful of the needs of rural communities. We've been pulling together information that speaks to that and sharing new and emerging services. For example, we've been advocating for needs-based syringe exchange programs as opposed to one-to-one distribution models.
We address issues of transphobia in many aspects of our work, including looking at how transphobia impacts individuals, organizations, incarceration, and access to services, the lack of trained medical providers, all impacted by transphobia and bias in society.
Carter Brown, who is the founder and executive director of the Black Trans Men Incorporated, spoke on how enlightening and enthused he was on the training that NCHP did. And he said it was really great that we get it and we can help providers around the country get it in working with transgendered individuals.
How can we as a larger network address social determinants more effectively? Wow, now that's a good question. I would Google it, but I'm exhausted. How about we just finish watching the video? I think it's almost over.
And as a larger network, we can effectively address social determinants by continuing to include social determinants of health in our training and technical assistance outcomes. We can also continue to engage our clients in conversations on the social determinants, especially racism and stigma that can be perpetuated in organizational culture.
As a larger network, CBA at JSI feels that we could more effectively address social determinants of health by working collaboratively with organizations to not only exceed CDC grant requirements, but also to support the development of innovative ways to address the poverty, stigma, and discrimination that perpetuate our nation's health inequities.
And as a larger network, we can address social determinants more effectively by sharing what we're each doing in a more coordinated way that allows us to demonstrate a unified approach to addressing a range of social determinants of health in measurable, high-profile ways. We can also help CBOs to recognize the social context of those they serve in order to help them to think beyond individual level behavior change.
Call out, the roots of stigma, the roots of health disparities, which often points back to these structural and social inequalities that exist. So not being afraid of calling that out when we see that, calling it out when we see it within our work, when we see it with our colleagues, but then also being very intentional about addressing those specific issues in all of the work that we do.
There is a certain power in naming it, claiming it, and making the explicit connections between the issue, which includes determinants such as racism, homophobia, and access to care, the action, which is our CBA work, and the outcome, which may include things like decreases in new transmission, increased access to care, and reduced health disparities. We must connect these dots, issues, action, and outcome, to achieve the goals of the National HIV/AIDS Strategy.
At the heart of our mission
stigma.
Partnership for Health and Heart.
Bam. Oops.
Real bond.